Hi, I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's video is the Tanner stages and puberty blockers. I have a good reference about this that's going to be attached after the video, so look for that if you need one good reference. So let's get on to Tanner stages. Healthcare providers use Tanner stages to describe a person's place in the process of puberty, which is the process of developing from a child to an adult. There are 5 Tanner stages, but Tanner stage 1 is actually before puberty starts, when you are a baby or a young child. In Tanner stage 2, a person who is assigned female at birth develops a breast bud under the nipple. And this little bud feels like a pinto bean or maybe a lentil, and it sits under the areola, that's the colored part of the nipple. Now at this stage, Tanner 2, there will be sparse pubic hair as well. In assigned females, Tanner stage 2 usually happens at about age 9 to 11. For a person who is assigned male at birth, Tanner stage 2 is when the testicles have grown in length to about 1 inch, or the size of an almond in its shell. This, along with the development of some scant pubic hair, happens at about 10 to 12, roughly a year later than the breast buds occur in assigned females. So, don't kids get underarm hair and body odor before this? Yes, they do. And this is the process called adrenarche. Adrenarche is the awakening of the adrenal glands that live on top of each kidney. The adrenal glands secrete androgen hormones, and they are responsible for the appearance of armpit hair and body odor. Now, adrenarche is not puberty, but it is a reliable sign that puberty is on its way, maybe in a couple of years or so. So, back to the Tanner stages. After Tanner stage 2, the child continues to progress through Tanner stages 3 to 5, at which point puberty ends. For assigned females, the breasts continue to develop to adult-sized breasts, and the pubic hair spreads across the mons pubis. That's the area of fatty tissue that's just above the pubic bone. For assigned males, also, between Tanner stages 3 and 5, we usually will see the arrival of the menstrual periods. That usually happens at about Tanner stage 4. An assigned female will notice that height will increase and the body shape and facial features will change, so that by that time, a person is looking more like an adult woman rather than a little girl. Let's look at Tanner stages 3 to 5 in assigned males. For assigned males, the testicles, penis, and scrotum continue to grow, and the pubic hair spreads across the mons pubis. For most assigned females, we saw the development of menstrual periods at about stage 4. This is all so much easier to see in an illustration, and I'm going to put a free handout of the Tanner stages on my website at lindagromkomd.com. So go on to that and look for the heading that says handouts, and you can download a copy. But for assigned males, in addition to the expansion of the pubic hair to cover the mons pubis, we also notice the development of ejaculation. And sometimes kids will notice this by having what they call a wet dream at night when they're asleep. In medicine, this is called a nocturnal emission. Height increases for assigned males as well, and body shape and facial features change. So between Tanner stages 3 and 5, you're going to see a little boy begin to look like an adult male, or at least more so in any way. Puberty blockers can put puberty on hold so that people can buy more time to figure out what they want to do with respect to their puberty. So it's no harm and no foul. The blocker can be removed and puberty continues on. Or, and this is the part that's so important to transgender kids, a puberty blocker can stay in or continue to be given as an injection, and cross hormones or cross-sex hormones can be given. Now, cross hormones would be what a trans kid would figure would be the right hormones. So if you're a trans female, that would be estrogen, and if you're a trans male, that would be testosterone. By the way, puberty blockers have been used for many years in kids who had the condition of precocious puberty. A precocious puberty occurs when puberty begins very, very early. So rather than seeing signs of puberty in an assigned female in the range of 9 to 11 years, you might see breast buds in a 5-year-old, for example. Or in assigned male, you might see testicular elongation or growth in an assigned male when they're only 6. That's obviously different. Now, what would happen if puberty continued on at that stage? If you have somebody who starts puberty very early, as in precocious puberty, that child will continue to grow, but they will reach their maximum height very early. So all of their life, they would be a kid with short stature. Okay, Alicia, I noticed that I have a slide here that talks about cross hormones. I should have used it earlier, but I didn't. If you can use it, great. If not, just omit it and go on to the next slide. So what do puberty blockers look like? Well, an injection that might be given every 1 to 3 months looks like any injection. But puberty blocker implants have been used for many years, like I said, in kids who had precocious puberty, but they are also used as an off-label indication in trans kids who are trying to put puberty on hold. Now, in this slide, I want to show you, let me enlarge this so you can see it more easily. In this slide, we can see where a puberty blocker is placed. It's placed in the inner portion of the upper arm. And you can see that there's a little steri-strip over that after an implant has been inserted. And so you really can't see it at all. Sometimes you can feel it because you can feel the outline of the blocker, which feels like a little matchstick. Now, to the right on this slide, you will see the kit that we use when we're inserting a puberty blocker. Here's an example of the puberty blocker kit, just a little bit larger, so in more detail. And you can see that there are a few instruments that can be used. There's medication for anesthesia and also for cleansing the area. It's very simple, and everything except for the Suprelin implant itself is right there. Now, you might be interested that there are 2 implants that can be used, the Suprelin brand implant and the Vantis implant. The Suprelin is marketed for children in precocious puberty. The Vantis is actually used for adult males with prostate cancer. That's why we say that this is an off-label, but certainly a very tried and true use for the puberty blockers. Now, here's kind of a sobering sight. This shows the actual implant device going into the arm to deposit the puberty blocker implant. I think this looks kind of horrible, but I've done many of these over the years. And once you have a kid numbed, we use a little numbing cream initially, and then I inject some lidocaine where this is going to be implanted. And I've never had a kid tell me that it was horrible. I mean, there might be an objection while we're doing it, but I remember I had one little girl who was acting kind of dramatically, and when we got this thing done, I asked her, well, was that so bad? What was it like on a scale of 1 out of 10? And she said it was like a 3 out of 10. And then I asked her, if you had a good friend who also needed to put their puberty on hold, would you recommend that they have this procedure? And she nodded her head so fast, it was an automatic endorsement. I hope this information was helpful for you today. Today we talked about the Tanner stages. Remember, there are 5 Tanner stages in puberty. The first Tanner stage really isn't puberty at all. Puberty starts in Tanner stage 2, and that's important for transgender kids because that's the earliest stage that a puberty blocker can be used to put puberty on hold. In this presentation, we took a look at what the blocker implants look like and how those are inserted. We will have more information on this topic in later presentations, but I hope this will at least give you a good start with information that you need. If this little video was helpful to you, please like it, subscribe to my channel, and spread this information on. Share it with other people who might need it. Thank you for watching, and I'll see you in the next video.